Hello, I am doing this video to teach you why you have type 2 diabetes and how you can reverse it. Why am I doing this? Because I have a friend who had died due to heart disease that was secondary to his type 2 diabetes, and this is really a legacy for him. If you get value from me and want to continue to work with me, I'll be revealing an opportunity to work with me because I feel it's very important to be transparent from the get-go. My name is Suzanne Kellner-Zinck, and I am a certified trainer of hypnosis and neurolinguistic programming who got very involved in this whole idea of helping people with type 2 diabetes because of the loss of my friend and because of a very interesting client case that came in about a month after my friend passed away. So this is something that is really, really close to my heart. So why do you have type 2 diabetes and how can you reverse it? It's not what your endocrinologist is telling you, and it's not what your doctor is telling you. That is what I can tell you. Who is this for? It's for men 40 to 60 years of age with type 2 diabetes. I want to work just with that age group because you'll be able to relate to one another more easily, who are frustrated with the lack of improvement following their doctor's advice, or maybe some of you have an adversity to conventional world of medicine. Maybe you don't want to be on medications, maybe you don't like spending hours in your doctor's offices. Whatever the case, you have an adversity to the conventional world of medicine, who are open to understand what is really happening in their body and want a natural way to regain their health. Who is this not for? Anyone who is not a man. This is not for women, it's only for men who are aged 40 to 60, who has not been diagnosed with type 2 diabetes or has been diagnosed with type 2 diabetes, but it's been more than 2 years since that diagnosis, who happens to be happy with this medical care. We have some house rules here. They're very simple. This is a very information-filled webinar. We're going to be talking about the physiology of how this all occurs, so turn off all distractions. Take notes, either on your computer, as I prefer to do it myself, or with a pen and paper, whatever works for you. Have your questions ready for your consultation call if this message resonates with you, because there's going to be a free consultation that you will need to have with me before anyone can go further with me. So who is this Suzanne Kellner-Zinck anyway, and why should I listen to her? Well, as I said before, I have two stories to tell of two different men in your age range. One died and one reversed his type 2 diabetes with our work together. And if you want to know the difference between the two of them, keep listening and watching. But first I want to get into the 5 myths told by your endocrinologist, because it's now time for you to think for yourself. I mean, if you're not going to think for yourself, who's going to do it for you? Myth number 1. Diabetes is a chronic and progressive disease which you'll have to live with your entire life. This is a myth, which means it's untrue. Myth number 2. Medication is the only way to treat type 2 diabetes. The truth is the medication given to type 2 diabetics worsens the disease process because it goes against the real cause of the problem in the first place. More on this later. Myth number 3. I have type 2 diabetes in my genetics. Actually, genetics has little to do with developing type 2 diabetes. We know from a study of epigenetics, which means above genetics, that the expression of the genes depends on things such as poor lifestyle choices. One of the problems that my friend had, he was unwilling to shift his eating choices. Environmental pollution, stress, he was under a ton of it from all different places, and poor sleep habits. And there's probably some other things too, but these are the basic ones that foul people up. Myth number 4, keeping your blood sugar down will decrease having the type 2 diabetes and having complications. The truth is that there's studies, 3 that I know of for sure, that have shown that medications Keeping the blood sugar down has been of little to no use in avoiding complications like heart disease, which is what actually ended up killing my friend. And he didn't even know he had the heart disease, stroke, kidney failure. Though the medication has helped to decrease the number of amputations and those experiencing vision loss, if it's caught in time. Myth number 5, increased exercise and lower calories will do the job. Sadly, the truth is, if a diabetic is taking the medications as prescribed, it will not matter how little is eaten or how much or long one exercises. More on that later. So what exactly is not type 2 diabetes? Type 2 diabetes is not a disease of high blood sugar, and type 2 diabetes is not a disease that is unable to be reversed in 90% of the cases. What is type 2 diabetes then? Excellent question. Type 2 diabetes is a disease of insulin resistance. So here's a really good question. Why are the doctors giving patients insulin if that's the cause of the problem? Well, honestly, it beats me. Perhaps the pharmaceutical companies have a hand in it because they make a lot of money on sales of insulin and the other drugs that stop working 6 months after being started, which are continued to be given to the patients, even though they no longer work. And another thing that I want you to understand that most people do not know is that when you are given extra insulin, this is what's adding weight to the body, and it's also raising the blood sugar levels when you get your A1Cs. I'll explain that later too. So how does insulin resistance work physiologically? Because it's important for you to understand this. First of all, insulin is a hormone that is secreted by the pancreas after we eat. Most of you probably already know that. The job of the insulin is to bring the sugar, which is called glucose once it's in the body, from the food we eat into the cells to feed them. With insulin resistance, the insulin is unable to do its job, so the sugars are unable to enter the cells. This is the problem, and that's why they give you the metformin to help with that process, to get the sugar into the cells, because the insulin's not working. Now the sugar is now forced to stay in the bloodstream, which is raising your blood sugar A1C levels. Why does this matter? Well, think of it as a metaphor. When you have a balloon that's filled to capacity, you eat the carbohydrates, releasing the insulin. The sugar is then taken to the liver. The liver takes the sugar, the glucose, and turns it into fat, causing fatty liver. Some of the fat goes to the pancreas, causing fatty pancreas. Fatty pancreas leads to beta cell dysfunction. Beta cells are in your pancreas. And the pancreas is no longer able to make the insulin because the beta cells are what make the insulin. So now you can see why giving insulin is so problematic in the case of type 2 diabetics. And we're only taking type 2 diabetics into consideration here. Type 1 diabetics need their insulin, they don't make any, all right? So this is only about type 2 diabetes. If the body's unable to use the insulin that's causing fatty liver and fatty pancreas, why give the patient more insulin? This treatment is contraindicated, damaging the body, and should never be given to a type 2 diabetic ever. So why do they even give insulin to type 2 diabetics? Because the medications that they give stop working. Metformin will work for about 6 months in most cases. Then they give something called gluburide. It's also given as an oral medication in a pill form. And the medication squeezes the pancreas to make more insulin. It again will work for a while, maybe 6 months or so, and is added to the metformin that's now doing nothing. It doesn't work. That's why they added the gluburide. When these two medications stop working, the patients are put on insulin, only making things worse. Then when the insulin stops working, they increase the insulin, causing the horrific complications we see many late-stage type 2 diabetics suffering. Those horrific end results for most people type 2 diabetics. So what do you do to shift the situation? Be mindful of the 7 ways to control blood sugar. Now remember, blood sugar is a symptom of the illness, not the cause of it. Insulin resistance is the cause. So blood sugar control method number 1 is the body composition. You must drop weight for better blood sugar control. There are many methods to do this. First, shifting what you eat to lower carbohydrate diet. Needs to be a diet that you enjoy, otherwise you won't stick with it. 2, intermittent fasting is another method. 3, increased activity, something that you enjoy doing so you'll keep it up. Blood sugar control method number 2 is to release stress. The adrenal glands release cortisol and epinephrine, raising your blood sugar. Without the insulin to balance this effect, due to the insulin resistance or low insulin production, blood sugar increases uncontrollably. Blood sugar control method number 3, sleep. Insulin resistance is seen to have been caused with as little as missing just 4 hours of sleep. Continually being sleep deprived can have long-term consequences on ever achieving normal blood sugar levels. So we need to get 7 to 8 hours of sleep to achieve normal regulation of blood sugars. It's just physiologically necessary. Blood level control method number 4, optimal function of your immune system. Infections usually cause elevations in blood sugar. So we have pathogens like flus and colds. We have blood-borne infections and gut issues, which cause stress on the immune system. The balance of the immune response can fight chronic infections and prevent immune-related blood sugar elevations. Blood sugar control method number 5, supportive nutrients. Many nutrients help blood sugar control the type 2 diabetes. Minerals such as chromium and vanadium, antioxidants like alpha-lipoic acid and selenium, nutrients like omega-3 fatty acids, CoQ10, carnitine, and acetylcysteine. Herbs such as cinnamon, gymnema, and berberine. However, you need appropriate testing to find out which ones you need and in what amounts. But you can take control of your health and well-being if you so choose. So what have you learned so far? 1, you learned that 90% of all type 2 diabetics can indeed reverse it. 2, you learned that your body is a self-healing mechanism when it's given what it needs to do its job. 3, you learned that there are lifestyle changes that you can make to reverse it. Number 4, you learned that with the correct information and guidance, you can reclaim your life and your vitality. And 5, therefore, you can own your own life and your own health should you choose to. What to do next? Many people have the best of intentions. Those that love you may tell you that you need to follow your doctor's advice. However, the patient's mind also gets in the way, telling them that this is too hard to do. The solution? To learn how to safely reverse your type 2 diabetes. And as I told you at the beginning of the video, I've created an opportunity for you to join me on a journey of shifting your mindset from fear to hope. Is it an easy thing to do? If you follow the guidelines, making the lifestyle changes discussed, you'll find it easier than going the medication route with all the side effects involved and the very poor outcomes. So this is what I have to offer you. Disappearing Type 2 Diabetes Safely course. It's a 12-week course for men ages 40 to 60 who are recently diagnosed with type 2 diabetes who want to reverse it holistically. And again, these are men who have been diagnosed within the last 2 years or so, no longer than that. And you will receive it at more than 50% of the price for $2,000 to regain your health and your life. That's a pretty excellent deal. I'd say an excellent deal. The course is happening from September 14th through November 30th, 2020. All done online from the comfort of your home, and it's being taught live. What will we cover in the course? We'll help you design a program that will work for you. We'll help you to create a food program. Let's be real, you're only going to follow a food program that you'll enjoy, so that's really important. We'll help you design a way to increase your activity, because you will only increase your activity if it fits your day and if you enjoy it. We'll help you to discover if you need supplementation, and as you learn, there's different bodily functions that require certain nutrition. If you're deficient in them, you'll have a more difficult time balancing your body's systems. You'll get the mindset shift to make it easier for you to succeed. I am, after all, a certified trainer, both hypnosis and neurolinguistic programming. And let me tell you something. If your subconscious mind is working against you, it's going to be nigh impossible to do anything even with the best of intentions. So we're going to make it so your subconscious mind will be working to help you to easily and without thinking about it. That's the best part, no thinking involved. Make the necessary lifestyle changes that you choose. You'll get your life back. 1, you'll learn exactly what you need to do to work with how your body was created to work naturally. Gee, what a concept. 2, you'll be able to do this at less cost than you're paying currently for the food you're eating, the medical interventions, etc. However, you're going to stay working with your doctor, and they're going to help you to get off the medications if you're on any, when your blood levels are at the place that they need to do, all right? So this is not an excuse to stop seeing your doctor. You continue seeing your doctor. We're just going to get it to the point where you'll be able to go off your medications safely with your doctor's okay. 3, you will physically feel better. 4, you're going to emotionally feel balanced, and trust me, that is very important if you want to have good relationships. People don't want to be around angry, sad, or irritable people, and it doesn't feel good to be that way anyway. And 5, you're going to experience a return of your mental clarity, most helpful to do anything in life, really. So my solution, the Disappearing Type 2 Diabetes Safely course, consists of the 12-week-long course from September 14th to November 30th, 2020, including 1, live teaching with me 1 time a week. Each session is going to last about 1.5 hours, and the value is $3,000. Second, you're going to get a question and answer session with me 1 time a week, which I've found in the courses that I've taken to be super valuable because we can ask questions of the instructor, so you'll be able to ask me anything that you need to ask me. If I have the answers, I'll let you know. If not, I will find out for you. And other people will also be on the calls, and they're going to ask questions too that maybe you didn't think of, or maybe you're too fearful to ask. You'll be able to get the input necessary. Value $997. 3, there's a private Facebook group for you to get answers both from me and from the community of students in the training. Value $997. And yes, I'm going to make sure that anything the students tell you to do is viable and is healthy for you. Otherwise, I will give it a thumbs down. I will let you know. And 4, you're going to get worksheets to help you with lifestyle changes at a value of $99. So would it be worth it if it only helped you to reduce your weight, bringing more mobility to your life, and maybe getting rid of some of those aches and pains? Would it be worth it if it helped you to get your blood sugar controlled so you're not feeling tired and irritable? Would it be worth it if it helped you to stop increased complications from happening? Would it be worth it? This would be a great deal even at $10,000. When this course gets launched after this pilot course, it's going to increase to $5,000. Still a great deal to cover one's health and not end up as my friend who died from the heart disease you don't even know after he had seen many doctors many times because he was in so much pain right before he died. However, because this is a pilot course, this means you're going to be helping me to put it together, which means it's going to work better for you, right? And that is why the cost of the course is going to be more than 50% off at $2,000. Because this course is going to be taught live, it's only being offered to 30 committed men who take action. For the first 30 people who qualify, you get Disappearing Type 2 Diabetes Safely course, you get more than 50% off the price for $2,000, and you get to help create the course. To see if you qualify, instant message me, and this is a hyperlink, so you can just tap this link, and that will take you to my personal Facebook page where you can instant message me, and just give me a couple of dates and times when you can have a free half hour, maybe 45 minutes for a free phone consultation. Have your phone charged if you're using a cell phone, please. There's nothing more frustrating than having a phone die in the middle of a consultation. So let's get you healthy and vital again without all the complications. And remember, the best part is because this is the first time I'm offering this course, you help to develop the content of the course to meet your specific needs. You'll receive the course at more than half off the normal cost, actually. And again, the training is 12 weeks long. It will happen from September 14th to November 30th, 2020. And you can do the whole thing from the privacy and comfort of your own home. So which way are you going to choose? You could try to go it alone, and many have succeeded doing just that. I see them on the diabetes Facebook groups. However, if you're the type of person who feels that they would rather have quicker results because you have all the knowledge you'll need along with supportive community, this could be a life-saving investment for you. On the other hand, many have tried to do this on their own, and they have failed, such as it's true of my friend. Although I don't really know how much of an effort he put in to change his eating habits, he certainly did follow his doctor's instructions with the medications. In the long run, you will be saving a ton of money, ton of time, while letting go of the fear that this disease brings once diagnosed. So what exactly are you getting again? 12-week-long course from September 14th to November 30th, 2020, including the live teaching with me 1 time a week. And again, you're going to need to be available for 1.5 hours. That's a value of $3,000. Second, the Q&A session with me 1 time a week. That's a value of $997. And we'll be on anywhere from an hour to 2 hours, depending on how many questions we have. 3, private Facebook group where I'll answer your questions and you'll get support from the community of students in the training. And I will definitely look at this group regularly to make sure that the things that the students are suggesting are actually helpful and not harmful to you, because it's important to get the right information, especially where your health is concerned. And 4, you're going to get some worksheets to help you with this lifestyle change at the value of $99. So it's a $5,093 value for only $2,000. Who is this course for? Men between the ages of 40 to 60 recently diagnosed with type 2 diabetes, who know that they can indeed reverse the disease in 90% of the cases. Again, mindset is most of those people. Who are interested in using holistic approaches, who are dedicated to doing what needs to be done to approach their goal, who will show up for the live trainings on time to benefit themselves in the group, who will add value to the private Facebook group with questions, who will show up for the Q&A sessions on time and contribute with great questions or insights into their own healing journey. Who is the course not for? Anyone who is not a man between the ages of 40 and 60. Sorry, females, it's not for you. Second, anyone who's been diagnosed with type 2 diabetes more than 2 years ago. 3, anyone who's unable to make the sessions as scheduled for the 12 weeks. I need you to be committed. 4, anyone who believes that going the conventional medical route is the correct approach for them. 5, anyone who feels that they are unable to reverse their type 2 diabetes, believing that it can only be managed and will most likely get worse over time. However, because this is going to be a live training, I can only accept 30 students max to take part to make sure everyone gets the help they need. And second, I'm only going to accept those students who are willing to do whatever it takes to get the results, because we want you to succeed, right? And I know when I was clearing my problems, I visualized a brain tumor away. I was dealing with some other chronic issues in my life. I applied myself to what my trainers told me to do, and I got rid of my chronic problems. So if I can do it, you all can do it. You just got to be willing to do whatever it takes without any excuses at all. It is your health after all. To apply to take part in the course and find out more, Facebook or instant message me directly at my personal page at Suzanne Kellner-Zinck with your time zone and a couple of dates and times you can do the free consultation to see if you're a good fit for the training. My best availability is going to be on Sunday, Tuesday, or Saturday. The consultation will take 30 to 45 minutes depending on how many questions you have, and if you're using a cell phone, make sure it's charged. I want to thank you for watching the webinar. Even if you're unable to join us for the course, and even if it isn't something that you're interested in continuing with, I'm sure you found this time to be a really good use of your time, given the information that you're able to learn. Information that you most probably didn't know all of, because I can tell you this. I knew a lot of it, but putting together this information, I learned even more. And I've been in healthcare since 1993, so that's a long time. Again, if you wish to have a free consultation call, find out if you're a good fit for the course, instant message me at this hyperlink right here. And give me a couple of times and dates with your location and time zone included, because people are coming in from all over the world, quite literally. And I'll get back with you the time and details for how we're going to do the call. Again, thank you so much for taking your time to watch this presentation. And I wish all of you the very best going forward.